Hey, hi students, welcome back. This is the second recording for Unit 8, focusing on the treatment of psychological disorders. In Unit 1, I talked about psychotherapy, which is a non-medical treatment to help individuals deal with and understand and manage their problems. Now we're going to look at effective psychotherapy and the factors that are important contributors to the development of effective psychotherapy. So one important factor is a therapeutic alliance, describing the relationship that comes to be formed between the therapist and the client. So it is a working alliance in that it is marked by a collaborative and trusting relationship that forms between the therapist and the client. It does depend on engagement, and engagement describes the emotional involvement or commitment that we can make with other individuals that comes to exist between us and others. And so when we have emotional involvement or commitment in a relationship and it's reciprocated, then there's going to be a collaborative and trusting relationship. And this is what marks a successful or an effective working alliance, is that collaborative and trusting relationship. It is described by trust, respect, and cooperation. And so when it comes to the therapist-client relationship, that partnership is also marked by an agreement by both parties, both the therapist and the client, on the goals and tasks that need to be met in order to achieve success together in the therapeutic setting. Okay, so the therapeutic alliance is a crucial foundation for successful therapy. And when there is a strong alliance, it's going to yield better therapeutic outcomes. Okay, so in this therapeutic alliance, these are some of the important attributes for both the client and the therapist. So the client participates actively, draws on personal strengths, abilities, skills, and motivation, develops confidence and trust in the therapist, and becomes more hopeful and less alienated. And the therapist also participates actively, provides genuine support, and monitors quality of relationship with the client. Okay? So these are all markers of a strong therapeutic alliance, and they're going to yield to reinforce the trust between the two parties, to strengthen the confidence that the client comes to feel towards the therapist, and to also create a sense of hope for the client, hope that there's going to be a positive outcome from the therapeutic experience. Okay, so what are other factors that also contribute to effective psychotherapy? One is the therapist himself or herself. So the therapist does bring a level of expertise, so that is a contributing factor. It is a strong determinant of an effective psychotherapy, but it's not the only factor. The therapist needs to seek continuous professional growth to develop their knowledge and expertise, and also to check in with the client to monitor their progress. And as they're checking in with their client, they're going to understand if there are any gaps, if there are any incongruence between what the progress is and what the intended improvement the therapist had aimed for, and then adjust accordingly, so make changes where necessary. Okay, and the client also plays an important role. The client's disposition also is a strong determinant in effective psychotherapy. In fact, the client's disposition is probably the strongest, the most important determinant of whether the therapy is going to be successful, because the client needs to actively participate, that they have to engage in the process. Okay, So when they engage in the process, they bring forth their strengths, their skills, their motivation. So they are driven to participate and answer the questions, put in the effort, put in the work, the work that the therapy entails. So now we're going to look at how psychotherapies differ. So there are two dimensions along which psychotherapies differ. One is insight versus symptoms and skill development, and the other is directive versus non-directive. So some treatments do emphasize gaining insight into the roots of the client's or patient's problems. So here the goal is to achieve insight into the root, the origin of the problem. Where is this problem rooted? What is its cause? What is its origin? Is what some therapies like psychoanalytic therapies are very much uh, um, uh, emphasizing determining the origin of a person's psychological problems. Other therapies focus on the person's immediate symptoms. So, what are the presenting symptoms in the therapeutic session, and how can we help the client develop skills to cope with these symptoms? Okay, so that's another type of therapy. So, cognitive behavioral therapy, which we'll talk about a little later, is one form of therapy that focuses on allowing the client to fulfill their potential by gaining those competencies, those skills to cope with their problems, their symptoms. Okay, another dimension along which therapies can differ is directive versus non-directive. So in directive therapy, the therapist plays an active role by directing the course of the therapy. So doing so perhaps by having a set list of questions that they're going to ask the client, or determining where they need to bring the client in terms of their mindset, in terms of the client's actions that they're going to take outside of the therapeutic setting. Okay, so here the therapist is in the active role, is directing the course and the direction of the therapy. But in other therapies, in other types of therapies, the therapist becomes more passive and allows the client to drive the interactions. So whatever the client brings to the therapeutic session is going to be explored, and there is no predetermined set of questions or predetermined activity or a questionnaire that the client will fill out. It's all driven by the client. So let's look at one form of therapy, which is a school of thought or a type of therapy, is psychodynamic therapy. Okay, so listed here are like psychoanalysis, free association, dream analysis, and transference. Those are all techniques that are unique to psychodynamic therapy. So psychodynamic is a school of thought that aims to probe the person's unconscious mind, because it posits that the person's problems are rooted or have been suppressed below the person's level of awareness. It's something that they can't access readily. It has to be probed through some technique. And so it is a school of thought that aims to analyze the individual's unconscious thoughts, and by probing the unconscious mind and bringing these thoughts to the surface, then the client can deal with them and start to understand the origin of these problems. Okay, so the aim is to help the client understand the source of the problem so that they can later on start to deal with them. But the primary aim is to understand the origin. So this is a school of thought that was first developed by Sigmund Freud, and Sigmund Freud formulated this very transformative theory called the psychodynamic theory. And the techniques that Freud developed, the first one is psychoanalysis. So psychoanalysis is a therapeutic technique. It involves analyzing the client's or the patient's unconscious thoughts in an effort to probe the unconscious mind and bring up the past. So the problems are rooted in the past. In particular, they are rooted in the patient's early childhood years. So here the therapist plays an active role because in the probing of the contents of the subconscious or unconscious mind, the therapist is going to start to interpret that content. So the therapist is going to add meaning, to assign meaning to what the client or the patient is bringing up from their unconscious mind. So one way to do this is through free association. So again, this is where the therapist plays a very active role because they are the ones interpreting the content that the client is unraveling through whatever technique the psychotherapist is using. Okay, so again, it's a school of thought that believes that posits that all the problems are rooted in an early childhood experience where some sexual conflict. The roots of the problems are sexual in nature, so they've been repressed in the person's subconscious. There's a sexual conflict that the child was unable to resolve, and so that conflict has been repressed. So let's look at one technique that is used as free association. Okay, so how will the therapist allow the individual to gain insight? Okay, again, gaining that insight, that understanding into the origins of the problem is to gain insight into the unconscious conflicts that underlie the problems. So in free association, the individual is encouraged to relate whatever comes to their mind during the analytic session and not to censor their thoughts. So just to bring up whatever comes to their mind, however trivial or embarrassing it might be, the therapist might probe them with some words, or they may just bring up some words on their own, and it has to be very free of any censorship. Okay, so that's free association. So here, what the client brings up, the therapist will analyze. So the second one is dream analysis. So again, the therapist is conceptualizing the content as being symbolic. So whatever the client or the patient is bringing to the forefront is symbolic in nature. It's not literal, it's very symbolic. So if the client says, oh, I have a dream of traveling, I'm in a train and it's going into a dark tunnel. Okay, the therapist will analyze that as meaning something. It's not literal. It's a substitute for something else. Okay, so let's look at dream analysis. So in dream analysis, the therapist will interpret the person's dreams, the content of their dream, and then we have transference. So transference is how the patient may displace or project onto the analyst those unconscious feelings and wishes that were originally directed towards important people in that patient's life during their childhood. So it could be a parent, it could be someone of authority, like someone in their life who has an authoritative role. Okay, so they're relating to the therapist in ways that reproduce or relive important relationships in the patient's childhood. Okay, so let's look at contemporary psychodynamic theories. So there are many contemporary psychodynamic theories that still practice this approach today. They probe into an individual's unconscious thoughts about their early childhood, because that's the origin of the problems. They're something that has been repressed from early childhood. but they also place more emphasis on the conscious mind. So they assign an important role to the conscious mind and to current relationships. Okay, so those also factor in influencing the person's psychological well-being and determining if they and the source of their problems. So while the focus is on trying to assist the patient in gaining insight into these emotionally charged, repressed conflicts, there's less emphasis on the sexual conflicts, okay, relative to Freudian psychoanalysis, right? The original psychoanalysis that Sigmund Freud developed, okay? And contemporary psychodynamic therapists might also incorporate things like emotional expression and warm support. Okay, so now we're going to look at another therapeutic approach, which is the humanistic approach or humanistic therapy. And so this is an orientation. It's a therapeutic orientation that emphasizes conscious thought, self-healing, and self-fulfillment. So they focus on the present, on one's conscious thoughts, and the need for self-fulfillment. In doing so, they reject biological or deterministic models of human behavior. So these are deterministic because these models emphasize that or posit that human behavior is a product of genetic inheritance. Rather, the humanistic approach focuses on the idea that humans, in fact, have unlimited potential. We all have the capacity to fulfill our potential to the maximum extent that we can, and it's not that potential is unlimited, meaning that it's not determined by any biological factors such as genetic determinants. So let's look at the goals of therapy is to achieve self-understanding and to promote personal growth. Client-centered therapy or Rogerian therapy. So client-centered therapy was formulated by Carl Rogers, and it's essential. That's why it's also called Rogerian therapy. It's after his name. So its essential premises are that each person has an inner self-actualizing potential, that there's a tendency and an ability to achieve greater self-development. So there's an inherent, innate ability and tendency and power to achieve self-development. And the counselor's role is to provide a warm, supportive, and non-judgmental atmosphere that is marked by unconditional positive regard. So unconditional positive regard means that the person in the therapeutic session receives complete love and acceptance from their therapist. So the therapist is providing a warm and supporting atmosphere, one that will improve the client's self-concept, so how they come to understand themselves, and encourage the client to have a better insight into their problems. Okay, so this is a school of thought. So it is a therapeutic orientation. Client-centered therapy is a therapeutic orientation that emphasizes active listening and reflective speech. So active listening is taking the time to understand what the client is saying, but also to understand the feelings between what is behind what is articulated, what is expressed. Okay, so to fully understand both the meaning, the literal meaning of what is said, but also the emotions behind those words, behind those statements. Okay, and then it also emphasizes reflective speech. So reflective speech is where the therapist may repeat what the client has said, but in different words, to mirror the client's feelings back to that individual. Okay, so the therapist provides that warm and supportive atmosphere, both to improve the client's self-concept, to help them gain insight into the problems, but also to encourage self-growth. Okay, so this is in contrast to psychodynamic theory, where the therapist plays a very directive role. In client-centered therapy, the therapist plays a very non-direct, is assuming a non-directive stance, is allowing the client to direct the direction of the therapy. Okay, so now we're going to look at the essential elements for client-centered therapy. Again, these are elements to grow, to achieve personal growth, and they're reflected in the approach to therapy. One is unconditional positive regard. So this, in the therapist setting, it involves creating a warm and supportive climate or environment in which the client feels valued. They feel valued even if their behavior might be evaluated negatively. Okay, so the client has a dignity and self-worth, and it's important, according to this approach, to ensure that the client is feeling valued even though their behavior might be evaluated negatively. Okay, so then we have empathy. So empathy involves feeling what the client is feeling. So that's having that empathy, the capacity to understand, to feel what the client is feeling. And genuineness describes the therapist's ability to share feelings as a real person in the relationship. Okay, so here the therapist is being authentic about his or her own feelings. Okay, so empathy describes reflecting, feeling what the client is feeling, okay? Whereas genuineness is being authentic in the feelings that they're showing to their client. So now we're going to look at behavior theories or behavior therapies. So if we look at psychodynamic and humanistic approaches, what they share in common is that they are insight therapies. So insight therapies, because they encourage self-awareness, they encourage the client to gain awareness around their problems, what the origins of the problems are. Behavior therapies, on the other hand, use principles of learning in order to reduce or eliminate maladaptive behavior. Okay, so this is where in this is a form of therapy that emphasizes skill development. Okay, and so it's going to use principles of learning, just some standard principles of learning, in order to eliminate or reduce maladaptive behavior. So behavior therapists assume that the overt behavior changes, assume that overt behavior change. So behavior therapists assume that of the overt symptoms of behavior are the problem rather than the underlying thoughts. Stop, pause.